Welcome to Lean and Green Healthcare, the show that explores how healthcare leaders are rethinking hospital operations, infrastructure, and sustainability to build smarter and more resilient systems. I'm excited to introduce our guest for today, Mohanned Afeef, the author behind the Healthcare Strategist, a widely followed newsletter for leaders across healthcare in the MENA region. Mohanned is a senior healthcare consultant and the creator of the influential Health System Flywheel, which is a model that he developed to help organizations scale sustainably by looping strategy, operations, and consumer-centered innovation. He has also spent over 20 years navigating frontline care, digital health, and national transformation efforts. Mohanned brings clarity and structure to complex challenges. Today's episode will explore how frameworks like the flywheel can drive real-world change and why aligning all parts of a health system around the patient is critical. Let's jump in. Hi, Mohanned. How are you? Welcome to the show.
Hi, John. How are you?
Amazing.
Thank you so much for the invitation.
It's a pleasure having you today. So I think I usually start my episodes by having a quick introduction about my guests, and it would be interesting to know how you landed into healthcare, if yourself you're a doctor, or how did you arrive in this amazing industry?
Okay. So this takes me back to, after graduating high school, I received a scholarship from the government to become a paramedic. And so I had a scholarship. I went to the United States. I did my education and training in the US and became licensed as a paramedic. And so I came back home and started to work in Saudi as a paramedic at many different organizations. But then, by 2010, I wanted to learn more. I thought that I could be more. And so I went back again to the US and I stayed there from 2010 until 2018. I, furthered my education and expertise and finally came back home in 2018.
So when you came back home, I'm guessing you was it an MBA or was it a master in public health or something?
A master's in public administration with a focus on healthcare organizations management and policy. My undergraduate was also in health policy. And so, I was basically at the intersection of health economics and policy analysis in the healthcare systems.
And when you came back, did you immediately get a job in Saudi? Or was it, did you join a private organizations or work for the government?
Yeah. So actually, before I come to Saudi in 2017 to talk to a lot of healthcare executives and the healthcare system in Saudi. So I reached out to, one of the largest hospital systems. And, at that point of time, I was really interested in virtual care. And so I introduced the idea of establishing virtual care, platforms or programs within the broader aspects of healthcare delivery within that system. And so, the chairman of the organization wanted to do that. And so when I came back, I actually had already a job. They offered me a job. And so I landed, at the institutions to establish the virtual care program at that organization.
And I mean, you have been a paramedic, then you got into that digital health landscape. How would you say that both those experiences have shaped your vision and what you brought back to the country after?
So I stayed in EMS, Emergency Medical Services, as a field from 2004 until 2010. So I spent about that time in the front line of EMS, whether it was in the US or in Saudi Arabia. And so at that time, after building and instituting a system in one of the private centers in Saudi, I thought that I could do more and I wanted to actually do more because I saw a lot of inefficiencies in the system. The healthcare system is a complex system. You have patients, providers, payers, different perspectives. And so I saw a lot of opportunities for me to intervene. But me as a paramedic coming into a board of a health system, telling them what to do, I thought that, I wasn't yet prepared and I wanted to further my education. And so this is what I did. And so after finishing my master's and landing in one of the largest private systems, I became much more acquainted with the inner workings of the hospital. And so from there, basically saw a lot of opportunities for me to, expand my horizons when it comes to healthcare operations, healthcare strategy, clinical excellence, and operational excellence.
And yourself, because Again, we didn't mention that, but you're one of the top voices in Saudi healthcare system. I mean, in the region, in MENA region. I'm guessing you are basically looking at what is being done in different countries, what is being done in Saudi. You are looking at the overall big picture of healthcare and the big frameworks. How did you come up with this concept of the flywheel? And if you had to explain it to someone with outside of, let's say, the public health and this ecosystem, how would you explain it?
So this is a great question. Expand.
I know it's a
Well,
lot. We
yeah.
can debunk it.
Yeah, so the way I arrived at the flywheel, the main motivation behind it, although I have been in healthcare for 20 years and I've seen a lot as far as rooms to improve and opportunities, I wanted to build this framework for me, for Mohanned. Like I wanted to understand how do health systems grow. I'm basically a person who's passionate about growth. So I wanted to understand how do health systems become these massive scale institutions? How do they grow? How can they acquire all of those patients? How can they hire, those talented physicians? What is their arrangement with payers? So I wanted to understand. And then I came at the conclusion, which is basically the alignment of, the patients, the providers, and the payers. But that was basically just the concept state. I was just conceptualizing what and how the system works. The way, I came at the flywheel is because, every strategy session, almost every strategy session that I have attended in, healthcare systems, when I was involved in healthcare systems, I saw that there was some kind of a disconnect between, whatever we talk about and what's happening on the ground in terms of frontline operations. And, I had a lot of question marks about some of those projects, some of the initiatives, because internally I was asking myself, would this move the needle when it comes to delivering exceptional care? Would this move the needle when it comes to clinical excellence? Would this move the needle when it comes to having the right relationship with payers? Because, at the end of the day, you can deliver the best care, but that's not enough, and you can deliver the best care and you can execute on, having great outcomes, but again, it's not enough if that system is not being funded by the right payers. And so once I saw that, I felt that, all of these actions are tied together. And so every decision that is being made today in any healthcare system, it needs to reinforce other aspects of the system. And so the flywheel, allow me to see the system from a different angle, instead of looking at it at strategy from a fixed mindset, we're looking at it from a dynamic standpoint. And so each action, each decision we make needs to reinforce the other. And so whatever kind of, things that we need to do to improve patient care, that needs to, feed the other action, which is hiring the best talent. And if we want to hire the best talent, we need to be able to afford those talents, but those talents eventually going to get us the best outcomes. And if you are able to produce greater outcomes, you are going to attract more patients. And so the system the flywheel starts to spin, as we get more consumers and generate more demand and produce greater outcomes, we get funded from payers, and payers unlock scale in terms of access to consumers. And so the more consumers we get, the more earnings we produce, and we can afford to hire great talent
Those are the
in
loops,
terms of
right?
physicians and nurses. And
That's
so,
what you
yeah.
define as a
And
loop.
so, yeah. And so the loops start to spin basically. And so we're moving away from the, kind of like the siloed way of looking at strategy, the 3 to 5 year corporate strategies stop into something that is more dynamic, that is built in momentum
Yeah.
within it. And so we need to ask ourselves, whatever I'm going to do today, is this going to accelerate the flywheel or is it going to slow it down?
So I'm guessing when you speak to the different parties, you have to also understand that this is a dynamic system, and
Yeah,
of course the public initiatives and the government policies are driving it in the way that they are regulating, they are privatizing, they are allowing
exactly.
reimbursement also.
Yeah.
How do you enable the dialogue to happen, and how do you make them understand that whatever they do must be dynamic and not, because usually healthcare providers might set up plans, let's say those 5, 7 years plan,
Yeah.
and it has to be also constantly evolving and recalibrated based on how policies are being shaped. Is this something that today you feel providers are really doing well?
So I think, yes, most providers are adaptive when it comes to the changes in regulations. They may not like, most of whatever is happening, but they adapt to it eventually. And it starts to influence the way they deliver care or do business with payers. But again, any kind of change that is being instituted, for me, if I'm going to be advising healthcare systems, I would have to tell them to look through the system, to basically look into how that change or proposed change would impact the flywheel, you know that everything that is happening, I would bring it back to the flywheel, because at the end of the day, that's what a compounding system is basically doing. They're
Yeah.
attracting more patients, they're attracting the right talent, they're producing greater outcomes, they're being reimbursed fairly, and so that's flywheel starts to spin. And so everything that is happening, I would just bring it back to the flywheel and see where it fits within those three loops. Whether it's the care loop, the outcome loop, or the value loop. And is it accelerating or is it decelerating? Is it building
So
momentum
speaking
or
of
slowing us down?
accelerating, on your newsletter, you very often share some benchmark of which groups have had the highest growth in terms
Yeah.
of expenses, which groups have had the largest expenses. What have you seen as the biggest trends in the healthcare landscape in Saudi in terms of growth avenues in the last 2, 3 years? We have seen consolidation, we have seen big battles between the largest players, and then some upcoming groups that are doing quite well in some specific segments. Can you maybe give us an idea, without naming them, of course, but if you could give us an idea of the biggest trends?
Well, we have a growth in population in Saudi. Whether we're talking about Riyadh, the capital, or the largest cities, the eastern province, Dammam, Tobar, and Jeddah on the western side. So there is a growth in the population, and so that demands that we, pay attention to, the infrastructure of the healthcare system. And so there is massive opportunities for the private sector, and actually the government is kind of advocating and pushing the private sector to start to take part into this, Vision 2030 when it comes to building the best healthcare systems around. So today we're seeing a lot of investment coming in from the private sector. A lot of, health systems are entering into the Saudi stock market exchange. So they're seeing capital as a way, capital market as a way to invest into building more and expand more. So, I mean, this is healthy. This is healthy for the country, because, you're going to get a lot of competition between different providers. Although some, providers are doing amazingly well, and some are still kind of pacing. But this is, I think, and I view this as a healthy, overall objective what's happening within the healthcare system in Saudi, without naming specific providers. But all of them, I believe, they're doing well within their systems or within the way they operate. But yeah, a lot of systems are expanding and going beyond their main geographic area.
Yeah, and I know you have also experience working with startups in terms
Yeah.
of the ecosystem of startups in Saudi in digital health. Do you see, how do you basically support them through your flywheel framework, and what would you recommend them in terms of collaborations, whether it's with the public or the private sector, to actually make an impact and build growth that will serve the kingdom?
So we have a success story, and I think I can name
Okay.
one of the companies. So Cura was the first virtual care platform to start in Saudi in 2018, and I was privileged to work with the CEO Wael, and the team at Cura in the past couple of years. But they started as one of the first virtual care platform, and they have assisted the Ministry of Health in launching their first virtual care application called Saha. They successfully delivered more than 1.15 million or close to 2 million consultations within the first few years of their rollout. And so when it comes to digital health and startups ecosystem in Saudi, I'd say that the market is right and adoption is really, really high in Saudi. You know, to just give you an example, it took Teladoc. Teladoc is one of the largest virtual care platforms in the US, if not the largest. It
Yeah.
took them 5 years to reach 1 million consultation. 5 years to reach to that 1 million. In Saudi, when the Ministry of Health rolled out the Seha application, it took them about a year to reach to 1.5 million consultations. So that just speaks about the volume in terms of adoption, adopting telehealth and virtual care. Now, the challenge that I see and the opportunities that I see today is that a lot of virtual care platforms are trying to be everything for everyone. And that's an issue because if any of the largest systems, the private system, decided to launch virtual care, and all of them actually did, then you're just competing with another large system as opposed to picking a specific patient segment that you cater for and you try to build around and to solve problems for that specific population. So today we're not seeing specific digital health companies or virtual care platforms that are catering to a specific set of patient population, say for instance diabetes or hypertension or metabolic, and lifestyle illnesses. We do have certain platforms that are targeting only behavioral health and wellness, which makes sense. But when it comes to the medical specialties, we tend to see a lot of startups that they want to do all of it. They just want to be everything for everyone. And I think that this is kind of like a pitfall because any larger system in Saudi today can launch, and then actually all of them have launched their virtual care platform, including some of the largest payers like Bupa and Saudi, for instance. They do also offer virtual care platforms. So it becomes really difficult for startups to compete with that, because those they have the access, they have the means, and they have the members or of the patient population. And so for startups, I would say focus on specific illnesses and just do that. And that sure would kind of pave a way to
Yeah.
kind of wedge their way into
Pick
the
a very
market.
specific niche. And for
Yeah,
the ones
exactly.
that are targeting actually the healthcare providers and trying to streamline their operations, whether it is through AI and diagnostic or whether it is operational workflows, what would be your advice in terms of choosing the best partners to kickstart proof of concept, to grab the first paying clients? Is there a specific framework you have, tactics to go about that?
So two things. I would say two things. So the first thing is make sure you understand how your product accelerates the flywheel. Okay, so that's the first thing you need to do. Like if you look at the flywheel, just make sure that you understand where that product fits, in which loop is it going to accelerate and how. The second thing, which is I think it's the most important thing, another important point is to ensure that whatever product that you build integrates within the clinical workflows necessary for adoption, because oftentimes we build products for us, for ourselves. Like I'm a product person and I enjoyed my time in startups and I learned a lot from product. And this is something I would advise my healthcare executives, colleagues, is to learn about product and try to adapt some of those principles from product management and into healthcare system. But again, going back to your point, I believe that if they can prove how the product accelerates the momentum within the flywheel and build it in a way that uh, integrates with current clinical workflows for physicians, that would help in adopting those solutions faster. And so it's a matter of time before they see value and then they could
Yeah.
secure something.
And you think Saudi is now the best market or one of the best to actually come up with innovations? Like
Yes.
you see capital being deployed, you see a vision being executed. Do you think healthcare providers are welcoming those innovations? Because of course there could be startups, but are healthcare providers open to innovations from outside and not necessarily risk taking, but are they willing to accept that? And again, I'm going to make a parallel with the US, where, when you're building a digital health startup, everyone tells you, go to the US, go to the US, don't even bother with Europe. Again, I'm a founder also in that space. And we get a lot of people telling us, why are you going to the Middle East? Why are you focusing on Saudi, for example? And it's simple. And I hear them in the way they are saying that in the US, you have such a huge market. You have people who are willing to try things. They are early adopters. Do you think providers in Saudi are capable of welcoming this influx, this flow of new startups that are coming up with innovations that might not be perfect, that might be risky, that might not be all secure? Again, it's something you need to make sure of course. But do you think this is the right time?
I think yes. So investing in health, investing in Saudi, this couldn't be, other than the best time for Saudi. And so anybody who wants to build, they should really think about coming to Saudi. We have a lot of programs, government funding for, niche ideas, and it's industry agnostic, so it doesn't have to be in healthcare. But that's a side discussion that we can take another time. Now, going back to your questions, would the private healthcare system in Saudi adapt these solutions? I mean, B2B is difficult. I've been there and I've done that. And, the sales cycles are long, and, the runway isn't really enough for you to entertain. So it's really tricky. I wouldn't go to a private health system with an MVP. I would definitely, I learned that the hard way. So don't go with an MVP, go with at least V1 of your product. And you need to prove your system from day one, because working in B2B, I believe in one statement: your first impression is your last. So if you go in with the clunky system, scrappy, and just, something that you've been bootstrapping, it's not going to work. Nobody's going to take you seriously. But if you go in with, the right mindset, and you show how that system is going to improve on, their flywheel, and how that's going to help them, either improve in terms of, efficiencies, or adding to the flywheel in terms of speed and momentum, that takes away a lot of the initial effort that you need to do to gain their trust. But from experience, some health systems will tell you, oh, we can do that, or we can build that. So there is this, I mean, the largest health system are more receptive. So know your customer, know who you're going to talk to. And I myself would give an example of how I came back from the US in 2017, 2018. I was talking to this, large healthcare system, and I just gave him an idea of what we could do with virtual care, and he adapted quickly. You just need to be able to tell that story really well, and show them, how your system or your idea is going to help them on the short term.
Yeah. Yeah, no, I agree, and I understand. I believe, yes. So you spoke about the funding, about the government support. That's one part. What I really would like to see is if there is any program, like you mentioned, where you have easy access to providers who are willing, let's say they have an incubation program for healthcare, and their doors are open to try out new things. They might have an innovation or manager who is there to support you also in building those startups, deploying them. Of course, it can also be commercial discussion and giving early access and so on. But right now we are exploring that. That's something I'm curious if this is available, because again, here it's still a relatively small market where everyone knows each other. And like you said, if you come up with an MVP in one healthcare provider and it doesn't work from the first few weeks, then the word will get spread. Whereas you have those huge markets, let's say US or India, or even Europe, if I take it as one market, where one small group, one small chain is not speaking with everyone. And the job market is relatively huge, that one manager will not necessarily know all the top managers from the same healthcare system. So they give you a chance to try out new things. And in Saudi, what I see as well is you have really that top of the healthcare, private healthcare system that are actually, and it's the same in India actually, not the same in Europe. In Europe, there is not that much of innovation for those private healthcare, but they are willing to develop that solution that you are doing in-house copy you and then spin it off as a company. They will tell you, let's do a POC. I will learn everything, the ins and outs of your solution. Then let me develop it and sell it myself. Thank you. Bye. So I think that's also something to consider when
It's
you
a risk.
pick.
Yeah.
It's a risk.
Yeah.
Don't go for the
Yeah.
big ones. Go for maybe the mid or small ones when you're not ready for fighting against
I
competitors.
mean, to answer your questions, the big health systems, the large health systems in Saudi, the private ones, some of them they have their own IT solutions company,
Yes,
and
correct. I
so
know. Yeah,
yeah, and so you just know who you're
more or
talking
less
to.
successful, but yes.
Yeah, yeah, they do. Yeah. When it comes to innovation in Saudi and healthcare, the Ministry of Health launched a digital health sandbox. So
Okay.
this is something that is active, and I can maybe if you want to launch something in Saudi, we can see how we can connect you with those responsible individuals. But there is a sandbox, and there are other programs not executed by the Ministry of Health that are government run and where they support technology in terms of innovation, deep technology, deep tech, etc. So there are a few funds, government funds, and of course you have the VC market, which
Yeah.
is a decently large market, although maybe we don't see a lot of expertise in industry wide, like a lot of the VC firms today. Maybe if I would advise that they need to have industry expertise, joining them because there are a lot of opportunities in healthcare, but I don't see a lot of VC firms investing in those. And so, I mean, this is an area they need to
Yeah.
look into.
All right, Mohaned. I think we are reaching towards the end of the episode. Maybe if you could leave us with one key principle for our listeners who are operators in healthcare, they are investors, they are innovators, what would it be? And I'm guessing, again, it's going to be around the flywheel, but can you give us one last tip?
So, yeah, I mean, if if it's myself, I would ask myself, what is accelerating my flywheel and what is decelerating my flywheel. But again, in terms of thinking of strategy, think of it in terms of how each action is reinforcing the other. The other principle I would leave my healthcare professionals with, executives in strategy, productize healthcare, and if you're not familiar with how to productize, this is an area that is definitely is needed, especially today with the consumerization of healthcare services. Healthcare consumers have many options. We need to know how we can productize healthcare. It becomes easier for consumers to experience healthcare services.
All right. Thank you, Mohaned. I'm going to put the link of your profile and your newsletter in the description. And it was a
Sure.
pleasure having you on the show. Thank you so much.
Thank you. Thank you, John.